Welcome to the 2022 CNA Practice Test. This test has 60 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it blue.
Question 1. A client with a terminal illness tells the nurse that he has begun praying every night. The client states, "If I pray every night, God will forgive me." This represents which stage of grief? A. Acceptance. B. Bargaining. C. Denial. D. Anger. The correct answer is B. Bargaining. This patient is bargaining to be forgiven in order to cure his illness. This is a normal stage in the grieving process. Question 2. Which of the following pieces of assistive equipment would be most helpful in moving an immobile client from their bed to a chair? A. Mechanical lift. B. Draw sheet. C. Gait belt. D. Wrist restraints. The correct answer is A. Mechanical lift. A mechanical lift should be used for immobile or NWB residents. A gait belt should never be used on an immobile resident to lift them and should be used on individuals who are FWB or PWB. Question 3. The nursing assistant prepares to give a patient a bed bath. Before turning the patient to rub their back, the nursing assistant notices that he has a Foley catheter in place. Where should the nursing assistant secure the catheter to ensure it is not pulled during the bath? A. To the lateral aspect of the patient's thigh. B. To the bed sheet. C. To the medial aspect of the patient's thigh. D. To the bed. The correct answer is A. To the lateral aspect of the patient's thigh. Securing the catheter to the lateral aspect of the patient's thigh ensures it cannot be painfully pulled during the bath. Question 4. A patient has just received news about the death of his spouse. He states to the nursing assistant, "I can't believe this has happened to me. I don't know what to do. How can I live without my wife?" The nursing assistant best responds by stating, A. You will need more time to cope with this loss. B. I understand you're in pain. I'll stay with you. C. This kind of thing will happen to everyone eventually. D. Do you and your wife have any children together? The correct answer is B. I understand you're in pain. I'll stay with you. This is the best answer because it reflects what the patient is feeling, pain, and stays with the patient to comfort him. Question 5. The nursing assistant helps a patient who recently had a right-sided stroke to bathe. Which of the following describes the best method to support the patient's independence? A. Allow the patient to perform as much of the bath as possible. B. Ask the patient what he wants to do. C. Complete the entire bath for him to conserve his energy. D. Encourage the patient to do the best he can to clean himself. The correct answer is A. Allow the patient to perform as much of the bath as possible. It is best for the patient to perform as much of the bath as possible, with the nursing assistant helping out when necessary. Question 6. A resident comes out of their room saying they have burned their leg after they dropped hot soup on it. The skin looks blistered and red. The nurse assistant knows this is A. Superficial burn. B. Partial thickness burn. C. Total thickness burn. D. Serious burn. The correct answer is B. Partial thickness burn. This describes a partial thickness burn. A total thickness burn appears waxy and white, while a superficial burn might be described as blotchiness of the skin with no blistering. Question 7. A client who has not had a bowel movement in 4 days would receive the most benefit from which of the following procedures? A. Endoscopy. B. Colonoscopy. C. Catheterization. D. Enema. The correct answer is D. Enema. An enema will help the patient in expelling fecal matter before it can become impacted. Question 8. The client asked the nursing assistant to assist her to cut her toenails. The nursing assistant knows this client has type 2 diabetes. Which of the following actions is best? A. Retrieve a safety clipper and hand it to the client. B. Report to the nurse that the client needs her toenails trimmed. C. Check the client's blood glucose before cutting her toenails. D. Check the chart for physician orders regarding nail trimming. The correct answer is D. Check the chart for physician orders regarding nail trimming. Diabetic clients often have special instructions regarding nail trimming. Check the chart for specific orders. Question 9. Which of the following options is the best method to prevent insomnia? A. Ensure the client eats 1 apple per day. B. Encourage the client to take several naps daily. C. Encourage the client to take several walks around the facility daily. D. Encourage the client to remain in bed throughout the day. The correct answer is C. Encourage the client to take several walks around the facility daily. Walking and physical activity during the day promotes rest and well-being at night. Question 10. The nursing assistant takes the temperature of an elderly client and finds it to be 100.6 degrees Fahrenheit. The client reports having just taken a sip of hot tea. Which of the following actions is appropriate? A. The nursing assistant waits at least 15 minutes before retaking the temperature. B. The nursing assistant records the temperature in the chart. C. The nursing assistant scolds the client for not letting her know beforehand. D. The nursing assistant takes an axillary temperature instead. The correct answer is A. The nursing assistant waits at least 15 minutes before retaking the temperature. Waiting 15 minutes ensures the temperature of the mouth will be more accurate. Axillary temperatures in the elderly are often not the best measure. Question 11. A client under the nursing assistant's care suffers from chronic foot drop. The nursing assistant can expect to find which of the following devices in the client's room? A wedge. B. A mechanical lift. C. Positioning boots. D. 2 extra pillows. The correct answer is C. Positioning boots. The boots will ensure that the feet are dorsiflexed to prevent contractures and discomfort. Question 12. A nursing assistant takes the blood pressure of a client and finds it to be 82/43. The client reports feeling dizzy. The nursing assistant should A. Take the client's pulse next. B. Report the finding to the nurse. C. Record the vital sign in the chart. D. Instruct the client to drink more fluids. The correct answer is B. Report the finding to the nurse. It is very important to report a symptomatic low blood pressure to the nurse for further investigation. Question 13. The range of motion term abduction means A. Moving the extremity away from the body. B. Moving the extremity toward the body. C. Moving the extremity above the body. D. Moving the extremity below the body. The correct answer is A. Moving the extremity away from the body. To abduct is to move away. To adduct is to move closer or toward. Question 14. Which of the following most addresses a client's needs in regard to spirituality? A. Ask the client why he or she is of a particular faith. B. Provide the client with warm water, soap, and towels every morning. C. Assist the client to the facility's chapel every Sunday. D. Treat any religious objects in the client's room as if they were any other. The correct answer is D. Treat any religious objects in the client's room as if they were any other. Support the client in their own individual religious needs. Treat any religious objects in their room with respect. Question 15. Proper body mechanics when lifting clients involve which of the following? A. Keep the spine curved. B. Bending at the waist. C. Bending at the knees. D. Avoid seeking assistance. The correct answer is C. Bending at the knees. Bending at the knees is the only proper body mechanic listed. Avoid doing all the others. Question 16. Which of the following would be a primary indication of hepatitis? A. Hypertension. B. Hyperglycemia. C. Jaundice. D. Hypotension. The correct answer is C. Jaundice. Jaundice, also known as yellowing of the skin, occurs frequently in cases of hepatitis, liver disease. Question 17. Which of the following aspects of care is important for a confused client? A. Checking the client's blood sugar every hour. B. Asking the client their name. C. Keeping the client contained in their room. D. Reorienting the client frequently with clocks, calendars, and family mementos. The correct answer is D. Reorienting the client frequently with clocks, calendars, and family mementos. Reorienting the patient frequently is the most important aspect of care. Keeping the client locked in their room could agitate them, as could asking them their name, which they might not remember. Question 18. What type of client may opt to receive hospice care? A. Client with kidney disease. B. Client with cancer. C. Terminally ill client. D. Client with diabetes. The correct answer is C. Terminally ill client. Terminally ill clients may receive hospice care, which is designed to relieve pain rather than to cure disease. Question 19. Cheyne-Stokes respirations occur in a client who A. has a history of chronic respiratory issues. B. is unconscious. C. is recovering from an asthma attack. D. is close to death. The correct answer is D. is close to death. Cheyne-Stokes respirations are a breathing pattern marked by increased respirations, labored breathing, and periods of apnea, no breathing. It is important to report these signs if discovered in a resident who is not expected to show them. Question 20. A client in the day room is having a panic attack. The nursing assistant should A. tell the client to breathe as slowly and deeply as possible. B. have the client talk about the panic attack. C. encourage the client to verbalize their feelings. D. ask the client about the cause of the panic attack. The correct answer is A. tell the client to breathe as slowly and deeply as possible. During a panic attack, the nursing assistant should make the client comfortable and encourage them to breathe slowly and deeply. Asking them to count backwards slowly from 100 can also be helpful. During an attack, the client is unable to talk about anxious situations and isn't able to address uncomfortable feelings and frustrations. While having a panic attack, the client is also unable to focus on anything other than the symptoms, so the client won't be able to discuss the cause of the attack. Question 21. Which of the following is a key part of care when administering a bath to a resident? A. Clean the perineal area of a patient before assisting them to clean their face. B. Use cool water when bathing the patient to promote better circulation. C. Allow participation in care to promote a sense of independence. D. Perform all care for the resident in order to conserve their energy. The correct answer is C. Allow participation in care to promote a sense of independence. Allowing the resident to participate in care will raise their self-esteem and allow autonomy. It is inappropriate to clean the perineal area before the face or to use cool water rather than uncomfortably warm water. Question 22. The nursing assistant knows that the term NPO means A. Bed rest only. B. No oral temperatures are to be taken. C. Nothing by mouth. D. Liquid diet. The correct answer is C. Nothing by mouth. NPO is a Latin abbreviation that stands for nil per os, or nothing by mouth. It indicates that the client is not allowed food, fluids, or oral medications. Question 23. The nursing assistant should tell the nurse if the client with diabetes A. does not touch their lunch tray. B. reports numbness in their feet sometimes. C. combs their hair without being prompted. D. decides not to finalize a will. The correct answer is A. does not touch their lunch tray. Someone with diabetes should always eat regular meals to keep their blood sugar relatively stable. Numbness in the feet is neuropathy, a common side effect of diabetes. Question 24. The nursing assistant knows that residents on bed rest must be turned every A. 2 hours, B. 1 hour, C. 6 hours, D. 8 hours. The correct answer is A. 2 hours. Residents on bed rest must be turned every 2 hours to maintain skin integrity. Question 25. Which of the following pulses will be most commonly used by a nursing assistant when acquiring vital signs? A. Popliteal. B. Radial. C. Brachial. D. Femoral. The correct answer is B. Radial. The radial pulse is the most easily accessible location to take a pulse. Question 26. The nursing assistant is helping residents to eat in the dining room when suddenly a resident stands from their seat and begins clutching their throat while coughing silently. The nursing assistant performs which of the following actions first? A. Ask the resident if they are choking. B. Call 911. C. Begin CPR immediately. D. Begin the Heimlich maneuver. The correct answer is A. Ask the resident if they are choking. It is important to first assess whether or not the resident is choking. If they are able to answer, air is still moving through the trachea. If they nod yes but are unable to speak, it is time to begin the Heimlich maneuver. The Heimlich should not be performed on anyone who is able to cough or speak. Question 27. A client at the facility receives a new roommate. While the roommate is in the bathroom, the client leans toward the nurse and whispers, "Why is she here anyway? Is she sick?" The best response by the nursing assistant is, A. I'm not sure. Let me take a look at her chart. B. Why don't you ask her yourself? C. She's here for the same thing as you. D. I'm afraid I can't share that information with you. The correct answer is D. I'm afraid I can't share that information with you. HIPAA requires you to keep clients' health information confidential. Period. Question 28. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that, after breakfast, it is most important to support gastrointestinal tract function by A. Recording intake and output, B. Brushing the client's teeth, C. Taking the client to the bathroom, D. Assisting the client to call family members. The correct answer is C. Taking the client to the bathroom. Taking the client to the bathroom will most likely prompt a bowel movement which supports GI tract health. A confused patient may not remember what the urge means. Question 29. A nursing assistant cares for a resident. Which of the following skin care measures are correct? A. The nursing assistant does not begin perineal care until a second staff member is present. B. The nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse. C. The nursing assistant applies talcum powder beneath the abdominal folds of the resident. D. The nursing assistant applies a prescription ointment as ordered. The correct answer is B. The nursing assistant notes an unblanchable red area on the resident's sacrum and reports it to the nurse. It is the duty of the nursing assistant to report any red pressure spots on the resident to the nurse. The nursing assistant may not apply any prescription ointments. Talcum powder is not recommended. A second staff member is not needed for perineal care. Question 30. Before shaving a resident, the nursing assistant checks for which of the following items in the resident's care plan? A. Shaving instructions related to problems or issues clotting. B. History of a heart condition. C. Presence of the resident's razor from home. D. Any previous refusal of ADLs. The correct answer is A. Shaving instructions related to problems or issues clotting. It is necessary to check the shaving instructions in the resident's plan of care to be aware of any problems clotting and the necessity of using an electric razor as opposed to a traditional one. Question 31. Fecal impaction may present with which of the following symptoms? A. Dark urine. B. Excessive flatulence. C. Small watery leakage of stool. D. Abdominal pain. The correct answer is C. Small watery leakage of stool. The watery leakage of stool around a blockage is the most specific sign of fecal impaction, also known as a bowel obstruction. Question 32. Dyspnea is a term that refers to difficulty with which of the following? A. Urinating. B. Breathing. C. Defecating. D. Swallowing. The correct answer is B. Breathing. Dyspnea is a term that refers to difficulty with breathing. Question 33. One of the patients on the unit is on airborne precautions due to suspected tuberculosis. To rule out the disease, the doctor has ordered sputum specimens to be collected. What is the best daily time for the nursing assistant to collect the specimens? A. Before a meal. B. After a meal. C. First thing in the morning. D. Last thing before the patient goes to sleep. The correct answer is C. First thing in the morning. The sputum produced upon awakening is the most concentrated sputum and will yield the most accurate result. Question 34. The nursing assistant walks into a patient's room and discovers him masturbating. Which of the following actions is correct? A. Scold the patient and tell him he should be ashamed of himself. B. Exit the room to provide privacy for the patient. C. Report the activity to the nurse in charge. D. Ask the patient why he is doing this to himself. The correct answer is B. Exit the room to provide privacy for the patient. Masturbation is a normal expression of sexual health. Attempt to exit quietly without disturbing the client in order to preserve his privacy and decency. Question 35. The nursing assistant cares for a client who is extremely agitated. She yells, screams, and frequently tries to bite staff. The nursing assistant should A. Use restraints to ensure the client's safety. B. Speak calmly in an authoritative and neutral manner to the client. C. Use a television to distract the client. D. Provide care only when absolutely necessary. The correct answer is B. Speak calmly in an authoritative and neutral manner to the client. Speaking calmly in a neutral manner can soothe an agitated client. Restraints are not appropriate for a client who is merely confused and can be placated. Question 36. Which of the following residents is demonstrating orthopneic position? A. A resident sits in a chair with their back straight. B. A resident sits on the side of the bed and leans forward over a bedside table. C. A resident walks using a cane. D. A resident lays on their stomach with their face to the side. The correct answer is B. A resident sits on the side of the bed and leans forward over a bedside table. Orthopneic position is meant to assist in breathing. Leaning forward makes it easier to get air into the lungs. Question 37. A resident is choosing items for breakfast. Which of the following items contains the most amount of potassium? A. Eggs. B. Cantaloupe. C. Toast. D. Strawberries. The correct answer is B. Cantaloupe. Cantaloupe is a melon that contains massive amounts of potassium. Other foods that contain high potassium include bananas and dark leafy greens. Question 38. When helping a client with left-sided weakness due to a CVA, the nursing assistant should position the client's cane A. in front of the client, B. on the left side, C. on the right side, D. away from the client. The correct answer is C. on the right side. The nursing assistant should place the cane on the right side that is the strongest so that it can support the weak side. Question 39. CPR, cardiopulmonary resuscitation, should be performed when A. a client is unconscious, B. a client is choking, C. a client has no pulse and is not breathing, D. a client has a pulse but is not breathing. The correct answer is C. a client has no pulse and is not breathing. CPR is performed on a client that has no pulse and is not breathing. Question 40. A nursing assistant enters a client's room and finds a fire burning in a trash can. The nursing assistant's first action is to A. call the nurse for help, B. remove the patient, C. try to put out the fire, D. pull the fire alarm. The correct answer is B. remove the patient. The acronym RACE is used for fire situations. Rescue, alarm, contain, extinguish. First, you must rescue the client to prevent harm. Question 41. Log rolling is a technique best used for which of the following patient diagnoses? A. Left tibial fracture. B. Spinal cord injury, SCI. C. Cellulitis of the right arm. D. Psychosis. The correct answer is B. Spinal cord injury, SCI. A SCI patient is prone to further damage and injury to the spinal cord if the legs cross over the midline in a twisting motion. This can be avoided with proper log rolling technique. Question 42. When a client constantly ignores the urge to void, the client is putting themselves in danger of what complication? A. Constipation. B. Incontinence. C. Insomnia. D. Poor appetite. The correct answer is B. Incontinence. Incontinence can occur if the bladder becomes too full and is unrelieved. Question 43. Which of the following types of grief is considered a normal and healthy part of grieving? A. Anticipatory. B. Complicated. C. Unresolved. D. Inhibited. The correct answer is A. Anticipatory. Anticipatory grief occurs before the loss actually happens and is a normal part of grieving. Complicated, unresolved, and inhibited grieving indicate there is a problem with recovering from the loss. Question 44. A patient is on a clear liquid diet. Which of the following is not allowed on this diet? A. Water. B. Tea, C. Coffee, D. Orange juice with pulp? The correct answer is D. Orange juice with pulp. Orange juice with pulp is not allowed. The pulp is not considered part of clear liquid. Tea, coffee, and water are all allowed on the clear liquid diet. Question 45. A client with a Foley catheter is ordered to ambulate twice daily. Before ambulating the client, the nursing assistant should A. Keep the bag below the bladder level. B. Raise the bag above the bladder level. C. Have the patient cover the bag with a pillow sleeve. D. Ask the nurse to confirm this order. The correct answer is A. Keep the bag below the bladder level. Keeping the bag below the level of the cavity ensures that bacteria cannot migrate up from the bag and up into the bladder due to gravity. Question 46. Which of the following items is necessary in order to place a patient in restraints? A. The hospital administrator's approval. B. The charge nurse's approval. C. Physical restraints. D. A physician's order. The correct answer is D. A physician's order. The physician needs to order restraints before they can be legally applied. No one else can ask for restraints for a patient, or it is considered battery. Question 47. A client eats a bagel and 1 large glass of orange juice. What is the correct way to record the amount of juice? A. 480 cc. B. 120 cc. C. 120 milliliters. D. 480 milliliters. The correct answer is D. 480 milliliters. The abbreviation of cc is no longer appropriate in the medical field. Only ml should be used. A large glass is 480 ml. Question 48. The nursing assistant knows that the responsibilities of the position do not include A. Helping a resident to bathe. B. Administering a medication. C. Keeping a resident's room tidy. D. Applying an ice pack as ordered. The correct answer is B. Administering a medication. Nursing assistants may not administer medications. It is not within their scope of practice. Only RNs, LPNs, and other properly licensed personnel may give medications. Question 49. Which of the following would be considered an example of battery toward a patient? A. The nursing assistant cleans the resident's glasses. B. The nursing assistant asks for permission before touching the resident to assist them to the bathroom. C. The nursing assistant bathes the resident without his or her permission. D. The nursing assistant keeps a resident isolated from others as a form of punishment. The correct answer is C. The nursing assistant bathes the resident without his or her permission. Bathing a resident without his or her permission is an example of battery. Keeping a resident isolated from others as a form of punishment is an example of involuntary seclusion. Question 50. The nursing assistant suspects that a resident in the facility is being abused due to multiple unexplained bruises, refusal to answer most questions, and refusal of ADLs. Which of the following actions should the nursing assistant take next? A. Notify the nurse assigned to care for the patient about the bruises. B. Report the suspected situation to the nursing assistant's immediate supervisor. C. Ask the resident repeatedly to identify an abuser. D. Wait for more proof in order to identify the abuser. The correct answer is B. Report the suspected situation to the nursing assistant's immediate supervisor. Abuse in nursing facilities or even suspicion of abuse should be reported immediately to the nursing assistant supervisor. This requires more intervention than the nursing assistant's scope of practice covers. Waiting or notifying the nurse only about bruises may delay getting the resident help. Question 51. MRSA is an example of which of the following? A. A resistant strain of bacteria that is difficult to treat with antibiotics. B. A bacterial strain that is easy to treat with antibiotics. C. A mnemonic to remember how to act if there is a fire in the facility. D. A set of activity guidelines designed to keep residents safe. The correct answer is A. A resistant strain of bacteria that is difficult to treat with antibiotics. MRSA stands for methicillin-resistant Staphylococcus aureus and is very resistant to most antibiotic treatments. Question 52. What is the best way for a nursing assistant to prevent infection? A. Use standard precautions when caring for residents. B. Apply an antiseptic hand rub before and after caring for residents. C. Wear gloves when in contact with body fluids. D. Frequent hand washing. The correct answer is D. Frequent hand washing. Frequent hand washing is the best way to prevent infection without a doubt. The other measures are supportive. Question 53. Nursing assistants work in a lot of different places. One place that CNAs work is a skilled nursing facility. This type of facility is also called A. Hospital. B. Rehab center. C. Hospice. D. Nursing home. The correct answer is D. Nursing home. A skilled nursing facility is also called a nursing home or long-term care facility. A hospital, while having skilled nursing positions, is not considered a skilled nursing facility or SNF. A rehab center would be a short-term facility where patients can go to recover strength after surgeries. Hospice is the term for when a patient does not wish for any life-saving measures to be performed, such as CPR or intubation. A patient can be on hospice while residing in a hospital, rehab center, or nursing home. Question 54. Who developed the hierarchy of needs? A. Erickson. B. Piaget. C. Maslow. D. Nightingale. The correct answer is C. Maslow. Abraham Maslow developed the hierarchy of needs. Erik Erikson developed a framework of development tasks. Jean Piaget describes the thinking development of people, and Florence Nightingale is referred to as the mother of nursing. Question 55. You are the CNA caring for Mrs. Thomas. You see a notation on the nursing care plan that states, ambulate at least 10 yards QID. This patient will be assisted with ambulation at which of the following times? A. 10 a.m. B. 10 a.m. and 2 p.m. C. 10 a.m., 2 p.m., and 6 p.m. D. 10 a.m., 2 p.m., 6 p.m., and 10 p.m. The correct answer is D. 10 a.m., 2 p.m., 6 p.m., and 10 p.m. QID is the acceptable abbreviation for 4 times per day. These times in most facilities are 10 a.m., 2 p.m., 6 p.m., and 10 p.m. Once per day is QD, twice a day is BID, 3 times a day is TID. Question 56. Which of the following lists the 5 senses? A. Sight, hearing, taste, smell, and common sense. B. Hearing, taste, smell, common sense, and auditory. C. Sight, taste, smell, auditory, and visual. D. Hearing, smell, taste, sight, and touch. The correct answer is D. Hearing, smell, taste, sight, and touch. The 5 senses are hearing, smell, taste, sight, and touch. Auditory is the same as hearing, and visual is the same as seeing. Common sense is not one of the 5 senses. Question 57. Where should the wheelchair be placed when transferring a stroke patient from their bed to the chair? A. On the patient's weak side. B. At the foot of the bed. C. At the head of the bed. D. On the patient's strong side. The correct answer is D. On the patient's strong side. The wheelchair should be placed as close to the patient's strong side as possible to minimize the distance they need to travel to get positioned into the wheelchair. Question 58. A resident is ordered to be in High Fowler position for each meal. Which of the following descriptions is the most accurate depiction of High Fowler position? A. The patient lies on their stomach for 20 minutes prior to eating. B. The patient's bed is at a 30-degree angle with the patient slightly slumped over to the left. C. The patient's bed is at a 60-degree angle with the feet propped up. D. The patient's bed is at a 90-degree angle and the patient is positioned sitting up. The correct answer is D. The patient's bed is at a 90-degree angle and the patient is positioned sitting up. High Fowler's is a description of the patient sitting straight up in bed, meaning the bed itself has to be at a 90-degree angle to support them. Question 59. What protective equipment should be worn when changing an incontinent patient? A. Gloves and gown. B. Mask and gown. C. N95 mask. D. Gloves, gown, and a mask. The correct answer is A. Gloves and gown. The nursing assistant should wear a gown and gloves at most as correct contact precautions. Question 60. Of the following symptoms, which one is most likely due to an infection in a resident? A. Pale skin. B. Tinted skin. C. Sudden onset confusion. D. Aphasia. The correct answer is C. Sudden onset confusion. Infection, especially in older clients, tends to cause sudden onset confusion. Tinted skin may be normal for an older client, as could pale skin. Aphasia could indicate the onset of a stroke.
Let's be honest. The CNA exam is hard, and the CNA exam is important. And to do well on the exam, it matters how you prep, not just how much you prep. That's why we at All Healthcare Careers have developed a work smarter, not harder philosophy. We will help you achieve maximum results in minimum time. To maximize your chances, we suggest that you sign up for CNA Premium. To help you get that score of 80% or higher, we'll make sure that you get your very own dedicated CNA study manager who will help you fix any CNA weaknesses you may have. You'll also have access to full-length practice tests, CNA flashcards, as well as our CNA Skills online module and customized homework assignments. You'll complete study missions that will help you be laser-focused on the areas that you need to improve and won't waste your precious time on materials you've already mastered. We are so confident that you will pass your CNA exam after studying with CNA Premium. We guarantee it. It's effective, it's efficient, and you will improve a lot. If that sounds interesting to you, then click the first link in the description to join CNA Premium for a 3-day trial. We can't wait to help you with your dream of becoming a CNA. Thank you for watching this video. We hope you enjoyed it. Check out these other videos that could help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel. And please share this video with your fellow nursing friends.